I don't know about a lot of countries, but in India at least, a lot of people die only because they cannot afford hospitalization. And though it is supposed to be affordable, they cannot afford several treatments or drugs because they are overpriced. And they're overpriced because there are greedy, corrupt people in the process who want to make money. Now, there are some government data sets about about costs of treatments and drugs, and I think from there we can get a ceiling limit, like the maximum value of different drugs and treatments and whatnot. So, um, what I want to do is I want to make like an app that Indian users, like Indian um, population, can download, and based on that, they can use OCR technology to scan their hospital bills. And once the bills are scanned, we can um, figure out several treatments and medicines and whatnot, and we can see whether or not, like, if a drug's overpriced, then we can detect that and we can flag it, and if a treatment is overpriced, then we can flag that. And however, inflation, like obviously this kind of inflation, is only one of the methods through which hospitals enforce corruption. The other is making patients go through unnecessary tests, giving them unnecessary drugs and whatnot. And obviously, since we do not want to use AI for this specific app because that adds like a layer of unreliability, that problem is very hard to solve because the doctor might be onto something or they might not be onto something, and there's no way to figure that out from such a very far standpoint, right? um, so what we can do, however, is I think there are some guideline data sets that we can follow, and maybe something else too. But I still want to incorporate both of these things so hospitals cannot be as corrupt as they are, and I think this can potentially save a lot of lives.